Hello, Dr. James Bogash, expert in health and longevity, and is a practicing chiropractor who focuses very heavily on soft tissue work and having a minimal exposure to fascia manipulation. This particular study on shoulder pain really resonates well. Before we go on, make sure you like this video, share it with somebody who you think needs the information and maybe is dealing with shoulder pain, needs some better answers, and subscribe to the channel. So, that being said, I see a lot of shoulder pain patients. Some of them we do really well with. Sometimes the shoulder is too far progressed. All four of the rotator cuff tendons are destroyed. There's labral tears. There's arthritis in the joint. You can fix a lot of stuff, but you can't fix everything. And I rely very heavily on soft tissue work of the shoulder. I do very little adjusting for the shoulder. So it has everything to do with balance in the rotator cuff and how well they work. A lot of different people have gone through rehab for the shoulder. I'm generally not a big fan because if you're strengthening, let's say, the supraspinatus and the external rotators, what the problem is a lot of times is that the internal rotators are too tight. If you don't address them, you are just building in a band-aid. You're not fixing the problem. And so once you stop doing the exercises, symptoms will ultimately come back, and that's not what we want. So fascia manipulation is a technique developed by the Stecco family out of Italy, and has really propagated and they've published quite a bit of research on the fascia manipulation, the ideas and the concepts behind it. But in basically, like, the fascia is a huge part of how our bodies move, and there are different planes, and there are places where those planes intersect. In those areas, there is a lot of receptors. So they've even demonstrated this on anatomical studies where they've dug out cadavers and then looked at these areas under the microscope. But it would make sense that if we have areas of the body where there's a lot of movement happening during development, the body's going to lay down a lot of receptors because it needs as much information as possible from those areas. However, when we have an injury or an overuse or something, frequently those problems start in the fascia. And in general, we really suck at treating the fascia. Most people, I've certainly talked a lot about how I believe a lot of acute problems or chronic problems start with mismanaging the acute, and that starts with treating the soft tissues. So with fascia manipulation, they identify these points. There's a specific diagnostic looking at different ranges of motion and if there's any reduced range of motions in these different planes and whether there's pain. There's a variety of factors going, but it's a very specific evaluation. And in this study, they looked at 18 people, averaged aged 18 to 45, so probably not people whose shoulder is already falling apart with arthritis and labral tears, but these people had shoulder pain. And what they found, it was hard to tell from the study, but it looks like it was almost a single treatment, even though frequently fascia manipulation may be a handful of visits, but it's certainly not weeks upon weeks. It's usually working on those, what they call densifications, these areas of the fascia that become thick. And if you work them properly, you will warm them back up and start getting more viscosity into these tissues. So what they found with using the fascia manipulation was there was an improvement in DASH scores. That's the disability of the arm, shoulder, and hand scoring. Pain levels went down, and painful range of motions went down or shrunk. All really good things from a very simple, again, possibly 1 or 2 time approach versus going to weeks upon weeks for rehab or surgery, or God forbid cortisone injections, which I feel very strongly that cortisone injections do more damage for a shoulder than they help. They really don't even, that really doesn't show that they help much more than just in the short term, because you're not fixing anything, you're just calming down the inflammation. So As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.